Hello everyone. Abuna Soryal asked me to make a short video about our current COVID-19 pandemic that is forcing us all into quarantine. So I'm sure you've all heard the terms flatten the curve, social distancing, and I want to explain why it is we want to quarantine ourselves in order to flatten the curve. So flatten the curve means we want to make sure that the number of people who are sick at the same time does not exceed the fixed number of healthcare resources that we have in this country. So it's estimated that at some point, 40 to 70% of people are going to eventually get the virus. The vast majority of them are going to do fine. 80+% are going to maybe have a cold. However, there is a certain number or percentage of those people that are going to need hospitalizations and they're going to need ICU beds. So in this country, we have 150,000 ventilators. So in terms of resources, one of the ones that would be worst case scenario if we run out of is ventilators. Ventilators are the machines that help us breathe for patients whose lungs are injured or not working well for one reason or another. In this country, we have a little less than 150,000 ventilators. So let's say 40% of the country got sick at the same time. That would be 150 million people. And let's say 1% needed ventilators, which is 1.5 million people. You only have enough vents for 10% of the people who actually need them, which is a disaster, right? 10 people are sitting in front of you who need to be intubated so they can get a breathing machine. And you have to choose between grandma and the granddaughter and the 20-year-old healthy college student, which is a choice no doctor or anybody really wants to make. So when we social distance, we're basically isolating groups of people from each other in order to prevent the spread of the virus to spread quickly throughout the population. So if you have one person who's sick and he may or may not know that he's sick in a group of 100 people and he talks to all of them and they all get the virus, then you very quickly exponentially will spread the virus among the population and you have the ability to overwhelm the resources. Thankfully, here in Florida, we certainly have cases. We have hundreds of cases just in Palm Beach and Broward County. So far, we have the healthcare resources to take care of these people to the best of our ability. A few people have died, which is true for most upper respiratory, lower respiratory pneumonias and flus that are out there. New York, on the other hand, is quickly on its way to overwhelming its available healthcare resources, which is why we've seen such a panic from the government up there. So what can we do? So I think the most important thing is social distancing, right? So stay at home when you can. If you don't need to be outside of the house, you really shouldn't be. Staying away from groups of more than 10 people because that's how you can really incite the virus to spread exponentially. And number 3 is good hygiene. Wash your hands, don't touch your face, sanitize around you, make sure you're cleaning the surfaces to really slow the spread. If everyone does their part and stays home, we will be able to flatten the curve, meaning align the number of infected people to below our available healthcare resources more quickly, which will hopefully lead us to be able to get out of quarantine more quickly.